Now's the time to finally realize we the people must make some choices.
Today, my name is Emily MacArthur, and I'm a member of Workers Strike Back and Revolutionary Workers, and I'm proud to be the MC of today's rally, which, I think it's pretty clear-cut why we're here today, the urgency. 32 cities across the country are rallying alongside us today for this National Day of Action demanding free health care for all. And to make this really feel like a rally, so we have one final speaker for you today. I'm really excited here, a long-standing provider speaking to us today about our broken healthcare system. Hugh is a professor emeritus of surgery at the UW School of Medicine, and he's got a pretty long track record in trauma surgery and all kinds of healthcare, traveling all across the world, seeing healthcare systems across the world. So please give him a warm welcome to Hugh.
Yeah. Thanks, Emily. Hopefully I keep this dry. No bad weather, just wrong, I guess. That's a very kind introduction, and I want to say thank you to everybody here, the organizers, and everyone who's toughed it out through the weather, and who stand up to do the right thing for health justice. Somebody once said 80% of life is showing up, right? And here we are. I'm going to start with a story. So a guy walks into a bar with a health insurance plan under his arm. No, that's the wrong one, excuse me. I have some good friends. Just came back for some travels. They were over in Italy. And my friend got sick. The usual traveler stuff, the routine. Chills, nausea, vomiting, diarrhea, the whole works. They thought it would blow over, but it just kept getting sicker, so they finally decided they'd go to the emergency room. So they went to the emergency room, got checked in, seen by a doctor, got an IV, got some labs. They were worried, being elderly, so they got a CT of their head and an EKG, make sure everything was okay. And after a couple of liters of fluid, felt a lot better, and they let her go. But the clerk stopped them on the way out and apologized, said, "We're sorry, we have to charge you because you're not a citizen of our country. You don't live here." And they said, "Well, okay," bracing for the bad news. They go, "Yeah, it's going to be it's about $220 US." I asked a friend of mine, "Closer?" "Like that, good, and get rid of that ring." It'd be about $5,000 to $8,000 in the United States of America for a deal like that. So, it's incredible. A few words about our organization, PNHP, Physicians for National Health Program. It started here in this state as a state chapter in 1987. And PNHP has advocated for reform in the U.S. healthcare system for a long time. A large part of our work is about mobilizing physicians, other healthcare workers, and the general public, really, to take an active part for enactment of a national, comprehensive, high-quality, not-for-profit, publicly funded healthcare system that serves all residents of our state and all residents of our country. Nationally, we're 30,000 members strong. Members include people from all walks of life, so it's not an inclusive thing. It's not just for doctors. And it was started by pioneers in the civil rights movement back in the 60s, a group of doctors who went down south, who helped the people, who sat on the porches next to black residents who protected their home from arsonists and marched next to Martin Luther King through the streets. Like many movements that seek to bend the arc of justice, we've had our squabbles in our organization over issues which bred discord and infighting, but we worked through them. Just like 1 year ago when over 20 local organizations dedicated to serious healthcare reform came together in a healthcare reform summit here in Seattle to band together in solidarity to help make single payer a reality in our state and our nation. Thanks to the leadership and momentum of Whole Washington and other organizations who are here today, This message has been taken to communities around our state for improved Medicare for all. Like everything else, Medicare's got its problems, but it was signed into law, as you know, in 1965 by Lyndon Johnson, and it has endured to help prevent the elderly in our country from dying in destitute poverty due to their declining health and inevitable illness. But yet, in the largest economy in the world, the #1 cause of personal bankruptcy is cited in numerous studies to be due to unpaid medical debt. In a country where, despite our wealth, we spend 40% more than the next closest countries, Switzerland and Germany, on healthcare, but our life expectancy ranks 27th compared to other countries. Our infant mortality ranks 14th, and we rank 28th in the number of doctors per person in our country. We graduate less doctors, nurses, and other healthcare professionals than in other developed countries, but instead we siphon off of other countries, some of the poorest countries in this world, over 8,000 doctors a year that come into the U.S. healthcare system. Many of them fully trained in their country, who take jobs in labs, etc. So if you want to shrink down immigration, it has innumerable repercussions that you can only dream of. Over 24% of all of the doctors in this country train in another country. So we take healthcare resources from the poorest countries because we don't plan and train enough to meet the needs of our country. So that's the bad news. The good news is we're here to make it better, right? We want to make it better because we know we can make it better, and we have the resources to make it better, but it's just a matter of priority, right? We want to have people over profits, but that has gone from bad to worse since Jim Page wrote that song, right? So we want improved Medicare for all. Now, Medicare has its problems, it has its warts. It only pays, maybe 30, 45% on the dollar. Medicaid pays about 25% on the dollar. But what we learned in the pandemic and with passage of the Affordable Care Act, the 25% on the dollar is better than nothing. And that's allowed our hospitals, our safety net, both here urban and rural, to survive these tough times. Without that Medicare money, which almost half of the people in our state and around the country and in the most conservative states rely on federal funding in order to get the health care that they can. So we know that if we band together to resolve and dedicate ourselves, we can make that change and bring health justice through a single-payer approach to medical care of all residents of our state and nation, because health care is a human right. It should not continue to be a luxury for those who can pay, and pay increasingly high premiums. I thought, well, great, I'm going to retire. I'm in my late 60s, now over 70, and so Medicare is going to take care of it. Well, it doesn't. As we've heard, you still have to pay 20%. And 20% of an $8,000 bill for 4 hours in the emergency room is a pretty big chunk of change for anybody and everybody. So we pay an increasingly high premium to federally supported private enterprises who defile the name Medicare into their for-profit healthcare plans. These schemes, under the pseudo-branding of Medicare Advantage, which is neither Medicare nor is it much of an advantage, but this is private, capitated healthcare that just takes money into the pockets of their CEOs and corporations, who, like bandits in the old Western movies, are busy brushing their tracks through the sand by branding themselves with catchy new logos, with peaceful, calming TV commercials, and sponsorship of professional sports team. If I see a name on the billboard at a professional sporting event, I just know that they've got their hands in my pocket or in my wallet. So we're paying them while they run to the bank with our money. The Medicare trust is money we all pay into out of our paychecks our entire working life. And it's a big chunk of money, and they want their hands on their money. They borrow from the medical trust all the time to support the other things to run our government. So recently, just within the last 2 weeks, the federal government gave Medicare Advantage plans, these for-profit HMOs, health maintenance organizations, a raise of almost up to 5% when they proposed only to give them 2% raise, but they went ahead and gave them a raise. So it's been shown in studies done by the Physicians for National Health Program that Medicare Advantage overbilled the federal government somewhere between $80 to $140 billion in one single year, 2023. Talk about waste, fraud, and abuse. They're wasting our hard-earned money that we paid into Medicare all our working lives. They fraudulently and relentlessly use advertising on TV paying retired sports stars and grounded space commanders to hawk their wares relentlessly. I sit around and I do chores while I have the Weather Channel on. Those commercials are continuous. There are channels that are nothing but Medicare Advantage commercials. And abuse, they are abusing the public trust, our Medicare trust, which they say will run out too soon before it takes care of all of our elderly and the very people who invested it their whole life. It's our money, and it can and will help fund a single-payer insurance mechanism. So we need a universal health care system backed by an equitable, progressive tax system instead of tax breaks from billionaires, or continuing to make Washington State one of the largest and most effective onshore tax havens in our country. It's our money, and it'll help fund us. So what are we going to do? As fight like hell. Or as Bob Marley says, get up, stand up. Stand up for your rights. It's your right to health care. It's your money in the Medicare trust. So we've got to stand up, speak up, out, and fight back. You only need to remember one thing today, the number 202. And that's the area code of Washington, D.C. You can pick up that phone in your pocket and dial 202-555-1212, and they'll get you in touch with whoever your representative is, your congressperson, your Senate. And if you don't know who it is, go on to any one of our websites, and there'll be links to get you there. The second thing is educate yourself. Go to those websites, learn about the issues, and relentlessly call, write your representatives, both nationally and for the state, every single week. Just say it's my chore. I'm going to do it every week. So you have choices. You have the access right there in the palm of your hand. So use it. You must take the time, seize the moment, Save yourselves, save your family, but most and equally importantly, save your brothers and your sisters. Solidarity for all. Everyone in, nobody out. Everyone in, nobody out. Everyone in, nobody out. Thank you very much.